Namaste. I am Professor Dr.G.G.Gangadharan, practicing at Bhadrappa, Bengaluru, with 40 years of experience in the clinical Ayurveda medicine. See, Panchakarma is synonym with rejuvenation, and also it is a healing process. Panchakarma is a very misunderstood concept in Ayurveda. People take it a different thing. People think that one Abhyanga is a Panchakarma, one Shirodhara is a Panchakarma. Actually, Panchakarma is a very long procedure, and depending upon the conditions and need of the patient, it can be divided into. However, there are three layers or three stages of Panchakarma. One is Purvakarma, Pradhanakarma and Paschatkarma. Purvakarma means nothing but pre-procedures before you actually doing your Panchakarma, how to prepare body to accept and get Panchakarma properly implied in the system. For that we have got a preparatory stage. This stage is again divided into two stages. What is Snehana and Svedana? Snehana is nothing but unctuation. How you unctuate your body. Unctuation is nothing but making your rough body little bit more snigdha, which is able to keep the tissues together. So we give ghee prepared of selected medicines. Some people we give soups of bone in the non-vegetarian people. And we give also, after Snehana, when the body is filled with Snehana, we make the body to ferment. Fermentation is a process which is known as Svedana, the second level of preparation. When Snehana and Svedana is done, which takes more than a week to 10 days to prepare the body for the Pradhanakarma, then we, depending upon the conditions, either you can do a emesis, forceful emesis, which is the medicated emesis, controlled emesis, where you vomit things from your system and in a controlled way, or you can have a purgation therapy where you purge things from your system, especially from the large intestine and small intestine, where all your biotic system are active. You remove it. Or third way of detoxifying your body is giving a kind of enema. Enema is very well known in modern parlance, but what we mean by enema is a kind of purification and strengthening. We give 450 ml to 700 ml of medicated liquids through the rectum in a controlled way by experienced physician and make it to stay in the large intestine, the rectum, more than 10 to 15-20 minutes. Even though Shastra says it should stay for a muhurta or 45 minutes. Even if you are able to keep it for 15 minutes in the rectum and release it, that will be a very good way of doing Panchakarma. Then this is the Pradhanakarma. There are three kind of cleansing. Then if you want, before going to other Panchakarma, we have to make the body back to normal. That is we going to Paschatkarma, where we ignite the body's digestive system, metabolic process, by giving very light food, which is easily digestible in 1, 2, 3, 4, 5 kind of days. Then in this way, take 21 days to do one Panchakarma if you want to do it. If you want to do all the Panchakarmas, it will take 21 into 5 kind of multiple. No one these days do this thing. But if you have got a disease, then Panchakarma is different. For example, rheumatoid arthritis. It is a kind of a disease which is autoimmune-mediated. Autoimmune system is nothing but your own body cells are working against you. In that, Panchakarma is one of the best, and I should say it is the only remedy as a permanent remedy to correct the autoimmune system by Snehana, Svedana and Vasti Karma. Vasti Karma is of different types. Yoga Vasti format, Karma Vasti format or Kala Vasti format. According to, you can select the materials and methods of Vasti Karma, then do Samsajana Karma, where you give food to digest. So Panchakarma that way is one of the elaborate procedure. Then Vasti Karma or kind of enema treatment by giving, that is the most important of Panchakarmas. And Ayurveda says, if you put all the treatment told in the old treatise of Ayurveda in one side and Vasti Karma in other side, both are equal. That much importance is there given to Vasti Karma. Actually, there are two kinds of Panchakarma. One is preventive and promotive Panchakarma, which you do annually to keep yourself healthy. And one is curative treatment when you do for a disease. For example, kinds of skin diseases, psoriasis, rheumatoid arthritis, IBS, chronic metabolic disorders of liver problems, pancreatitis. All these conditions we use curative Panchakarma. The preventive or promotive Panchakarma, which is these days known as wellness programs, is an excellent method of removing the toxin from your body which is getting accumulated in a seasonal manner. All of you know there are 6 Ridus, there are 6 seasons in a year. Shirodhara, Vasandascha, Grishmo, Varsha, Sharad, Hima. These 6 Ridus are categorized into 2 zones. One is hot in nature, one is cold in nature. So when from cold nature, when you switch out the body into the hot nature, body accumulates certain kind of toxins which become the primary cause for any metabolic disorders. So that kind of a physiological Panchakarma, which is done as a preventive or promotive measures, are done annually, especially in the rainy season. So rainy season is the time where body accumulates toxin and it is ready to come out. We say that is a Chaya concept. Chaya is a condition of Vada vitiation in the body or Dosha vitiation in the body before it's breaking into Koba, which vitiates and reaches to other tissues or localizes to other organs. So when it is Chaya time, we do Panchakarma, especially in the Shravan, that is Karkidakam in Kerala's parlance, we do that time. That's the best time for Panchakarma as a preventive measure. As a curative Panchakarma, different methods are done. There are 5 elements in Panchakarma, that is Vamanam, Virejanam, Vasti, Nasyam and Sira Vethanam. But in that normally what we do is Virejanam and Vasti are very common. Vamana in very selected cases of very predominant of Kapha is there, especially in psoriatic conditions and asthma conditions, chronic liver conditions. Vamanam may be a reasonably better procedure as a Panchakarma, which needs lot of care and supervision and expertise. So very few people do it properly. Virajana is very commonly done procedure which remove all your pitta from the body, especially it is good for any kind of gastritis, acidity, GERD and kind of conditions where pitta is aggravated. And Vasti is very good at Vada predominant conditions, especially rheumatoid arthritis, osteoarthritis and neurological disorders, all kind of DMDs and other things. Vasti is the best. And if you want to touch your brain tissue, I think Vasti is the best element. It can reach there through different preparations. This is how Panchakarma is being done, and these are the utility of Panchakarma. And it is good to know that Panchakarma is a unique procedure told in Ayurveda, which no other system has gone to explain in such a detailed way, which can handle all the chronic metabolic disorders, which are the biggest problem of today's society.